Myself, Dr. Ashok, consultant laparoscopic surgeon, works in Jayashree Hospital, Begur. I'm experienced around 13 to 14 years now in general surgery, laparoscopic surgery. I do advanced laparoscopic surgeries, also gynecological surgeries, endocrine surgery, and breast surgeries. Discuss about irritable bowel syndrome, which off late we are seeing more patients coming to us with symptoms of bloating sensation, burping. They say that they'll bring out a lot of gas from the mouth, from the anus. They'll have that irritation, burning sensation in the abdomen, vague pain abdomen, and they mistake it for gastritis and they'll take a lot of medicines over the counter. Still, they won't be getting relief out of those things. Basically, this is because of irritable bowel syndrome, which is happening because of the lifestyle changes, the stress where they are taking from their work, not able to sleep properly, taking the food at the wrong times, avoiding regular food, taking a lot of junk, eating a lot of fat food. So why often we are seeing all these things are because patients are eating at a wrong time where the intestinal juices are not present optimally, so that help in digestion. They are not having enough exercises so that whatever they eat, it is able to digest. And of late also we are seeing that patients are developing some irritation to certain kind of foods, basically what we call it as spicy, masala, oily foods or deep fried foods, which are repeatedly fried in a oil or a seam, tawa or a pan, where people are exposing to again lot of adulterated products, which results in indigestion. And because of the stress what they are taking, because maybe the professional or maybe the personal issues, they don't have enough time for their body to recover or recuperate from the insults. So how do they present? Most of them they'll present with bloating sensation. As I said, they feel at indigestion, burning sensation in the abdomen or in the chest. They'll have throat irritation, they'll have constipation, or they feel like running to the toilet whenever they eat something which is spicy. So these kind of symptoms usually they'll be considered as irritable bowel syndromes if it is present for more than 3 to 6 months, repeatedly happening whenever they're exposed to certain kind of foods. So how do we have to identify or investigate these things? Basically, we will investigate with endoscopy to rule out any gastritis is there. If there is any bleeding, or if the patient has got fever, or if there is any mucus discharge, or if there is any weight loss, or if the patient has got a fever or vomiting. So these are the symptoms where we need to investigate thoroughly by doing colonoscopy or endoscopy, by passing a tube through the mouth or through the anus to see the intestine for any ulcers or reasons for the indigestion. And if nothing is found out, even after blood investigations, so we will consider by exclusion, like irritable bowel syndrome. So where the patient has got two types, where predominantly constipation type, where they'll complain that they have constipation. They feel like abdomen is bloated, not able to pass your motions, or if they feel like even though they passed, immediately they have that urge to pass again. Or the other type, what I was telling, is diarrhea, where they rush to the restroom immediately after they eat. So the frequency of using restrooms will be increased in this kind of, even though they feel like they have passed, they have that sensation of incomplete evacuation. So what is the treatment for this? Basically, there are two kinds here: lifestyle changes and food habits. One has to be very strict in their food habits. They should eat good fiber like vegetables and fruits, avoid junk, avoid spicy and masala foods, specifically chilies and dal, so which will reduce some amount of irritation to the intestine. Second part is lifestyle changes, like have a good sleep and good exercise, so that whatever you eat, it should be digested. If you have at least 8 hours sleep, so the body will get some time to recover out of it. There are medications which are for the treatment of this, but basically the treatment lies in lifestyle changes and food habits. So any kind of warning signs which are seen other than the symptoms of bloating sensation or irritation, so one has to consult the surgeon. So we are in the JHU hospital here to solve your problems and also clear your problems. So you can come anytime, visit us, so that we'll take care of you. Thank you.